Thank you so much for listening to this episode of Earrings Off. We want to invite you to subscribe, rate, and leave us a review. You can find us on Facebook at Earrings Off Podcast and on Instagram at The Earrings Off Podcast.
Welcome to Earrings Off. I'm Lou.
And I'm Teresa. Let's get started.
Hey, Lou.
Hello.
Today, girl, we're talking about American Heart Month.
Yeah, it's February. Always an important time.
Yeah.
You
know, if I were in the office, I would be wearing red this month along with my red dress pin.
Oh, yeah.
Highlight the fact that it's Heart Month. It's an important month for us as African Americans, and I'm thankful for it. To bring the spotlight onto the significance of why we need to pay close attention.
Oh, yeah.
To our heart health.
Well, absolutely. It's also an important topic for me personally. My mom died from congestive heart failure. So I watched her try to manage, heart disease for years, mm-hmm. and eventually succumbed mm-hmm. to it. So I'm excited about today's discussion as we try to educate and shed some light on this disease.
I lost an aunt to congestive heart failure, and I have another aunt who's dealing with it now. But the difference is, the technology. The aunt that I lost many, many years ago, at the time she was going through it, the technology that my aunt that's dealing with it now wasn't available. Mm-hmm, and, mm-hmm. She has, what do you call that? A defibrillator, mm-hmm, mm-hmm. That keeps her heart going. Internal. I mean, it's. Are
you talking about?
Body. I don't know.
Do you mean like a pacemaker, not a defibrillator? The defibrillator.
Girl, did I just say defibrillator?
Yeah, I think you mean a pacemaker. You know what?
It's It is a pacemaker, but it acts as a defibrillator because it doesn't. It. This is what my cousin told me anyway. It stimulates her heart when mm-hmm. it gets below a certain number of beats. So it's a stimulator of some sort. Okay. Let me get out of that lane because I'm not a doctor.
I hear you.
But she has this device that's keeping her alive, and
Well, you're right. We're not doctors or medical professionals, but we do know that the leading cause of death for women in the U.S. is heart disease. So that's an important. So
let me share some statistics around that. Okay.
Yeah.
Cardiovascular. We're going to specifically talk about African American women for a minute. Cardiovascular disease kills nearly 50,000 African American women annually. Did you know that?
No, I knew the number was high. That's a lot. Yeah.
And of African American women ages 20 and older, 49%, Lou, have heart disease. That's half almost.
Right. Yeah.
That's staggering.
Yeah, it is.
But here's the other interesting fact that I'm hoping that today's conversation will at least inform others about. Only 1 in 5 of African American women believe she's personally at risk. Yeah. So we're not even aware that this is a thing for us, and over half of us suffer from it.
Well, you're right, and we need to make sure that we're on guard because our symptoms of heart disease, they look different than symptoms in men, and so sometimes it can be often overlooked. So we want to make sure that in our discussion today that we help educate folks and educate ourselves about what to look for relative to heart disease. So,
yeah, thank you for that segue. So today we're going to be talking to Shaun and Kim. Shaun and Kim are unique in that they are twins. They are nurses,
Mm-hmm.
and they were diagnosed with heart failure at the age of 40. So I'm looking forward to hearing their story and them sharing some facts with us about heart disease and how it looks for women versus men. They are nurses, Shaun, an advanced diabetes clinical specialist, and Kimberly, a nurse practitioner. So enough for me about them. Let's get into the discussion. Today we have some fascinating guests, Shaun and Kim, who are twin sisters and nurses, as well as they were both diagnosed with heart failure at the age of 40. Welcome, ladies.
Mm.
Thank you. Appreciate you having us.
Yeah. So we're gonna. I don't want to waste any time. I'm so excited about today's conversation. We're just gonna jump right into the questions. Would you ladies talk about the prevalence of heart disease in African Americans? How much of a problem is it really in our community?
It is a huge problem. It's a huge problem. What many people, particularly women, fail to realize is that heart disease is the number one killer of women. It's not cancers. It's not anything else. It's heart disease. And the problem is that Black women in particular are disproportionately affected by heart disease. And there are many reasons for that. One of the reasons that I like to hearken on a lot is the fact that Black women have a tendency to be the backbone of our communities. You know, we're designed and we're just built to take care of everyone else. So a lot of times the small symptoms that we may be having that may be telling us that something is wrong, we have a tendency to ignore it because we got to make sure the kids are off to school. We got to do the cooking and we got to go to work and we're in school and we have our careers. So that's one of the things that disturbs us the most. And of course, there are a lot of other things as to why it's so prevalent in our communities. Disparities in care and things like that as well.
So, Kim and Shaun, can you share a bit about your story as it relates to today's topic? Because Teresa phrased it well when she said, we are stoked because you have an amazing story. And we would just like for you to share a bit about, your diagnosis. And we want you to talk about your traveling production, Six Sisters at Heart, about your role as volunteer ambassadors for the American Heart Association's Rise Above Heart Failure campaign. So we are all ears. Tell us about your journey, please.
Well, I was diagnosed with heart failure at the age of 40. Healthy, didn't have anything else going on, no diabetes, no heart disease, nothing.
Wow.
I was
nothing.
Not a thing, went to the gym. I was an ER nurse at the time, working 12-hour shifts. I was, thinking about going back to school. So, I didn't think anything was wrong. But again, as I mentioned earlier, busy.
Right.
So busy, not paying attention. Even nurses, we're horrible patients, by the way. We generally don't take good care of ourselves sometimes. But I was preparing to go to work one day and left something upstairs, went upstairs to get it, and I got acutely short of breath. And I remember getting to the top of the stairs thinking, well, that's weird. I mean, acutely short of breath to the point where I had to lean on the banister for support.
Right.
And it was just,
right.
So I said, well, that's weird. Well, guess I got to go to work, got to pull this 12-hour shift, brushed it off, went to work. That's how we do. And went to work, got acutely ill. I became the patient that day. They threw me on the stretcher. I had palpitations, got really short of breath, thought I was going to pass out, and became the patient that day. So they worked me up.
So Kim, when you say you had acute symptoms, meaning, like you said, for the sake of our listeners, you hadn't had any idea anything was going on. This was an episode that occurred that day. No warning, no nothing. You were working out, living your life, no precursor conditions, nothing to alert you that something was amiss. Right.
Well, hindsight is 2020 though, and one of the things I realized after diagnosis is that I was so tired and fatigued, and had a little bit of swelling in my legs. But, sometimes if I eat a lot of shrimp and crab at the beach, I was like, okay, maybe my legs swell. But the fatigue, I was working 2 jobs at the time, and I was working 12-hour shifts, and I was just busy. So the tiredness and fatigue was not unusual. And that's the thing.
Right.
Yeah. Went on to the doctor and saw the cardiologist, and they ran a few tests and did an echocardiogram, did a stress test, and I failed them. And they didn't look good. And they told me on that particular day, they said, well, we know why you feel so bad. You got heart failure. I said, what?
Wow.
Yeah. It was an incredible day. It was an incredible day.
Wow. And
the thing
Shaun,
is that I was going to say that the thing is that since we didn't have any issues, we knew it might be genetics. So that's kind of where my sister's story picks up.
Yeah, that's what I was going to ask about it. And Shaun, can you share a bit about what happened with you, your diagnosis?
So after my sister was diagnosed, the initial part of that was, to support, my sister, that's kind of tough. Being a nurse, we know what a heart failure patient to us looks like. They really don't look like us. They're not in their 40s. They're not usually women that young. And they usually have a lot of comorbidities. They usually have uncontrolled high blood pressure, uncontrolled diabetes or something. She had none of that.
And I just want to say, because this is all audio, and it's unfortunate we don't have the video, because you both are beautiful and you look vibrant and healthy, and so
the picture of health.
Exactly. That's the phrase, the picture of health. Yeah.
So when when she went through her initial shock of the diagnosis, and we sort of got together, kind of settled down, and she said, well, maybe you should go and just get checked out, because we both worked really hard. We both worked at the same facility and hustled to do our thing. And I said, well, I'll just go just to sort of alleviate your fears about stuff. So I made an appointment with my doctor, and then they said, well, it's probably nothing, but we'll just run the test just to be sure. So then they referred me to the same cardiology office that my sister went to, different providers, but we went to the same cardiology office, and I got the stress test, failed the stress test. So then I went and they did the echo the same day. And then the tech left out the room, just like they did with my sister, to go get the doctor. And they never do that. Yeah. And they came back into the room and said, well, we know what's wrong with you, Ms. Rivers. I'm like, oh, here we go. You have heart failure. And if it wasn't so strange, I think I would have laughed at the moment.
Right.
But when you have a good functioning heart, there's something called your ejection fraction, which is, the amount of blood that clears your heart, with the beats. It should be around 60. I think her ejection fraction was 20%, I think. So that's how well her heart was not functioning at the time. And then mine was about 30 at the time of our diagnosis. So they were really trying to figure out how we were even functioning at all when we were diagnosed.
Wow. And when you talk about the fatigue, that was the first thing. My mom had heart disease and actually passed from congestive heart failure. And years ago, the first sign we had, she went with her sisters on a trip. And actually her nephew, my first cousin, had driven his mom and her sisters to Tennessee, to spend the weekend, and they were all excited. And when he got back, he called us, to say, your mom, when we would just take a few steps, she had to sit down. Mm-hmm. And we'd never seen anything. And he said, I just want to let you know, she, everywhere we went, we had to find somewhere for her to sit. And my siblings and we started calling each other saying, did you hear what he said about mom? And what was that about? And that's when we started trying to figure out what was going on and taking her to the doctor and got the diagnosis of heart disease. So, yeah.
Yeah, that it is a very common symptom of heart failure. But like I said, it's often overlooked, because again, if you're busy, and you've got all this other stuff going on,
Right.
you don't pay it any mind, especially if that's the only symptom that you have. So yeah. It's pretty common.
Yeah. Wow.
I would imagine though, Kim and Shaun, and if you would speak to this, if it's an indication, is that you started out by talking about the fact that you were both in the gym, taking care of yourselves when this happened. I wonder how much that helped you in continuing on with your day to day. And the fact that you were at 20 and 30% of what your heart should be functioning, how your heart should be functioning, and did not collapse prior to when it finally caught up to you. So I wonder, was that helpful? The fact that you were exercising a bit?
Yeah, I know our providers told us that we compensated very well, with an EF of 20 and 30% for someone who may not have been in a healthier state.
Right.
And may have had some of the other comorbidities. They may not have fared well statistically.
Right.
Someone who's diagnosed with heart failure with the numbers that we have perish within the first 5 years of diagnosis.
Wow.
Yeah.
So
Wow.
with the numbers that we have, we're not even supposed to be here. Wow. But that's God all day.
Wow.
Oh yeah. Oh yeah. Yeah.
Yes.
Don't get me preaching.
I hear you. Hey.
Yeah.
Well, you know what? You're in the right place for it.
Statistically, we're not supposed to be here, but because we were in pretty good physical health, we took pretty good care of ourselves. We compensated pretty well to get through those first 5 years.
Wow. So tell us a little bit about your traveling production, Sisters at Heart. Love that title. Love that.
It was it's pretty amazing how that all came about, and Shaun can speak a lot more to it as well. But my sister and I own a diabetes clinic in Petersburg.
Okay.
When we decided to go back to school, get our advanced degrees, nurse practitioner, clin spec. So we run a diabetes center. And we were connected with a gentleman through our church. We're in charge of the nursing ministry at a large mega church here in Richmond. And the D. Davis Productions is the production company that came to our church to put on a play around prostate cancer. He does a lot of work. He does almost like Tyler Perry style plays, but around educating communities on health disparities and health things. So the play that he brought to our church was on prostate cancer, but he also had a play around diabetes. So we were introduced, and because of our professional background, we connected in hopes that we might connect with him and help him with the diabetes project, come on as consultants and things like that. But he didn't know our heart story. So he Googled us, and Shaun will tell you, I don't think we've ever been Googled before, but been Googled.
I Googled you guys. I know all about you. No, I'm kidding.
Then he Googled us, and he found out about all of our story about heart failure and our journey and our work with American Heart and on the national level with American Heart. And we didn't know that he was in the process of producing a play around heart disease, but he tabled it because he didn't have a story. And it's crazy how God will do stuff. God will use pain for his purpose. I believe that. So
I do too.
I do too.
There's no doubt we survived for something.
Yeah.
So Shaun can really speak, and we've been traveling with the play, but that was pre-COVID for sure.
Yeah. Oh yeah.
So pre-COVID, so picking up where she left off, we actually met in our office, and once he found out about our heart story, he wrote a play based around our heart story, of course, and it's called Sisters at Heart, and it's a huge stage production, like she said, like the Tyler Perry stage production with really good professional actors and actresses that are really good singers. It's got the music, it's got the dance, And, anyone who really knows us know we love New Edition. So, they have to throw that in there. Those are dudes. But it's a really good production, and it's got the education components in there. It's got the laughter, the comedy, but of course it's got the seriousness in there, and it sort of really gets the dialogue going about our journey from the beginning of our diagnosis and how we had to cope with our families with the diagnosis and that type of thing. And it also gives the statistical data. And even as we tour, when we go into the different cities prior to the production, so for instance, we'll tag it with like a health fair. So we'll go in prior to a health event, and they'll be able to do statistical data gathering at the plays.
Okay.
So they'll be able to do like a before and after sort of informational gathering to find out what the audience actually has learned during the course of watching the play. A lot of the people that come to the plays, they don't go to the scientific sessions.
That's right.
For
right.
These big, pharmaceutical companies. They go to the churches and they go see the Tyler Perry plays. But those are the ones that are perishing from heart disease.
Right.
Well, those are the people that we're trying to reach.
Okay.
So it's very effective.
Okay. Well, that's amazing. But my next question is, I have to ask this. Did you get a walk-on part? Anything? I mean, are you in the play at all? Yourselves? I mean, anything?
They tried to put us in there. We really tried hard to stay in the back with that. But as people get to know us, they know we're a little on the crazy side too. So we really kind of get into that sort of thing. Have a few walk-ons. And one of the things that I like about the play is that intermission, depending on the city we go into, we tap into local cardiologists and have them come in and be a part of a panel discussion during intermission. And we talk about what was viewed and what happened in that first session. And we answer some audience questions and things like that. And then we move into the second part of the play. So it's edutainment, as my sister says, and that's what we label it. So we're entertaining, but we're trying to save the village because we're dying.
I was about to say,
yeah.
I am telling you, when Teresa and I launched Earrings Off, that was our goal, to use this as a vehicle to try to educate and do our part in the community. And what you just described, that is amazing, because many times people are intimidated in different environments and they may not seek information. But what you've done is you've assessed, okay, where can I get this information to people that need it so that the people won't perish? However that needs to happen. And so we applaud you in doing that. Thank you so much for caring enough to get out there and see what you could bring to try to address this very important issue. So as your role in the American Heart Association, what about the Rise Above Heart Failure campaign?
Well, when we first were diagnosed with heart failure, we maybe a few years in, we really started getting involved with the Rise Above Heart Failure. We were actually tapped by the American Heart Association to sort of get involved. We actually started to get involved through our church, doing some work with the American Heart Association, doing the education with their blood pressure screenings and things like that. But with this new endeavor with the Rise Above Heart Failure, they really wanted to do some new work as far as educating folks on educating the community on what heart failure was, the signs and symptoms of heart failure, the treatments of heart failure, and educating our community on what heart failure looks like, especially women and those of African American descent.
Right.
And young people with heart failure, because there are a lot of people with heart failure who are actually between the ages of 40 and 60.
What?
They all aren't above 60.
Right.
We're getting overlooked. Right. So that's really where we really started getting involved with the Rise Above Heart Failure campaign.
Can we talk a little bit about the factors that impact heart health, like high blood pressure, high cholesterol, family history, age, gender, weight, stress, all of those things.
Of course,
Uh,
the things that we can't control in our community, we talk about diet, we talk about smoking. If you smoke, you need to quit.
Mm-hmm.
Obesity is epidemic in our community.
Mm-hmm.
So diet is very, very important. The low fat diet is very important. So those are just a few things. There's some things that we can't control, but you need to be aware of. You need to be aware of your family history. Heredity is something that you can't do anything about, but you need to be aware of what your family history is. You can't control the skin that you're in, but you need to be aware of if your family, if your father had heart disease, if your grandparents had heart disease,
Mm-hmm.
Those type of factors that we can control, well, that you at least need to be aware of.
Mm-hmm.
So those are just a few things that we need to be on the lookout for. If you have high cholesterol, if you have hypertension, control your diabetes. Those are a few things that play a part in heart disease.
Okay. So what are some symptoms of heart disease that you might be having a heart episode? What should we be looking for? Because I know I've read somewhere that sometimes, particularly in women, that the symptoms can be overlooked because ours may look different from men. And, we're sort of just dismissed like, no, you're okay. And released, told by medical professionals to go on back home. You're okay. So what should we be looking for?
One of the things that I really stress with my patients when I'm instructing them, first of all, is to know your body well. You know you better than anybody else on this planet.
That is a great point.
And what I tell them is, this is what you do. Make a mental picture of what your good day feels like and storage. So if your good day means there's no chest pain, there's no shortness of breath, I'm not dizzy, I'm not having palpitations, I can do my regular day-to-day activities without any problem, and store what that day looks like. Right. And then when a different day comes along, you have something to compare it with. You have a baseline. The thing is that we stress, though, is to make sure you don't ignore it. If you put the information in storage and your computer is telling you something's different, you then have to act on what you're seeing and not ignore it. So that's the first thing. We have to be able to acknowledge our own bodies and what our bodies are feeling like. That said, heart disease is a huge, like a crock pot of stew. There's a lot of things included within that stew, right? So there are, for example, cardiovascular diseases, and there are also diseases that affect the electrical circuits of the heart. They're different. So cerebral, and there's also stroke. There's cerebral vascular disease as well. They all affect the vasculature of your body. So generally, when people ask me about signs and symptoms, we're talking about heart attack, right? But that's not the only. Right. That's not the thing. That's coronary artery disease. So that's only one part of heart disease.
Okay.
So for a heart attack, we're looking for chest pain is always the major symptom. However, with that said, and just to your point, women a lot of times don't get the symptoms that everybody else does. You see these commercials on TV with the guy, usually a Caucasian guy, grabbing his chest. I'm having chest pain. Women sometimes don't present that way at all.
Okay.
So one symptom is chest pain. There may be shortness of breath. There may be nausea, vomiting. There may be sweating diffusely for no reason. There may be dizziness. You can have jaw pain, arm pain, back pain, stomach pain, or any combination of those and still be having a big fat heart attack. Wow. Some people who have diabetes don't have chest pain at all, because diabetes can cause something called neuropathy. And neuropathy, we generally think of tingling in the hands and feet, numbness. But you got to think, if diabetes affects those nerves, wouldn't you think that it affects the nerves that touch your heart too? There are nerves that touch your heart. And if they're damaged, they don't work. And if they don't work, they can't tell you it hurts. So you have silent heart attack.
Okay. And I have to tell you, I appreciate the way that you break this down in layman's terms for us to understand. The part that you said about know your body. You know, just pay attention to how you normally feel, because you know when something is off and you
Right.
know something is not quite right. It's not complicated, that you know, okay, what is that? That's different. So
Mhm.
yeah.
Yep. And the other piece to that too that I want to speak on that we're really passionate about is that even once you figure that part of it out, there is still an issue of getting the right person to hear you. So, and particularly with African
Yeah.
Americans,
Yeah.
especially with women,
Yeah.
because there are some, I'm afraid to say, and I'm a provider too, but I'm afraid to say that some providers say, oh, it may just be anxiety.
Mhm.
Go home, relieve your stress, and it's fine. Well, she's having a heart attack, and we've just ignored those symptoms with her. What I tell my patients is Shaun will speak to that too. We need to be the CEO of our healthcare. Right. We're in charge. You know, we're at the center of our healthcare universe.
Yeah.
It's like running a big Fortune 500 company. But in order to run it effectively, you got to know what's going on, and
Right.
you dictate the care, and you decide what's going to happen. And if an employee is not listening to you or doing what their job description says they should do, you fire them and you find someone who will, because at the end of the day, the business has to survive. Your body must survive, and your body is counting on us to get this right. So we got to keep yelling at the rooftops. I'm not right. This is not right. No, I'm not a professional, but I know my body. Something's wrong. And if they're not listening, you find somebody who will. Real passionate about that, because it's killing us.
Yeah.
A lot of times women will present and they'll say, you know, they'll come to the ER and they'll just, and I teach that they'll come in with something called ADR, and it's kind of my slang term. They'll come in presenting with something called ADR, and the patients in the class say, "What the heck is that? Ain't doing right." ADR, then ain't doing right, because they'll come in
I
with
love it. I love it.
because they come in with these vague symptoms. I just have a little indigestion, but I think I'm gonna take a whole bottle of Tums and it might go away. If they have to swallow a whole bottle of Tums and they still have chest pain, honey, it's not gas. You need to go to the ER. You know, and that's what I tell them. And you stay there until someone listens to you.
Okay.
That is amazing. So we talk a lot about self-advocacy and patient care, the disparities there. So thank you so much, Kim, for sharing that, and especially the way you broke it down about being the CEO and actually going through and firing somebody who's not listening. We have to do that, and we have to not be afraid and own that, right?
Right.
So with that, would you talk just a little bit about, in keeping with that theme, talk a little bit about if a person comes in with all the symptoms that we've talked about, and that individual is the person providing the healthcare is not listening, what specifically, you know, in order to get that doctor to listen to them, what should they say? You know, we don't want them to go in and start. How can they help the doctors help them?
Yep. You go ahead. It's keep a log. It's keep a log. You know, if they start having symptoms, keep a journal or keep a log of their symptoms. Especially if it's something that's recurrent. You know, when did you notice your pain? How long did it last? What were you doing when the pain started? Were you active? What does anything make the pain stop? You know, can you how long does it last? Those type of things, and present that to your provider. And after you've presented all your information and they still don't listen to you, that's grounds for firing. Find someone that will, because you presented your data.
That's good. Yeah.
Okay. So as a follow-up to that, what should that physician be doing to access the specific question is, how does a physician access the severity of a patient's heart problem?
There are a lot of things that we can do as providers. The probably the most important thing that we can do initially is listen. And not just listen to get data, but really understand what the patient is telling you, and to be able to engage in a good communication where you can ask the appropriate questions as well. So once we get that information, there are a lot of tests that we can do based on what they're telling us. For example, EKGs are done routinely all the time. And EKGs basically are stickers we put on the chest. They're hooked up to a machine, and it's designed to assess the electrical circuitry of the heart. It can pretty much tell us right away if there's something acute going on, like a heart attack. Further down the line, in my case in particular, if we're considering heart failure for a patient, there are echocardiograms that we can order, which is an ultrasound of the heart, which tells us a couple of things. It helps us to determine cardiac output of the heart, how much blood is coming out of the heart with every beat, as well as how the heart is structurally, how the one-way doors or the valves look, and some other structures of the heart. Stress test is something that's also very common. They hook you up to an EKG and they get you to walk on this treadmill for a few minutes, and they determine your exercise tolerance by doing that. They're looking to see if you're short of breath with exercise. They're also looking to see if there are any ischemic changes to your heart as well. So there are a multitude of tests that we can do, but the tests are only as good as the information that the patient gives us, because we order the test based on what the symptoms are and what the patient experience is. So if the patient information is not good, we're not going to order appropriately. We're pretty much shooting in the dark.
Okay. Teresa and I aren't medical professionals, but when you referenced earlier that heart disease is like a crock pot, so I know there are many different components to that. But then what I'm hoping to help listeners understand is, if they have heart disease, what can they expect in terms of treatment options? How does that look? Can you provide just a bit of general information about what they might be able to expect? I know it covers a wide spectrum, but at the beginning, what kind of options are they going to be presented with?
Well, initially after testing, and once we actually have a diagnosis, right? Because in order for us to treat, we got to know what we're treating.
Right.
So there are all kinds of medicines for all different types of treatments. There are medications for hypertension.
Okay.
Of course, so hypertension is a cardiovascular disease, right? It affects the blood vessels. There are medications that we can use to control heart failure. Heart failure is one of those things that one of the symptoms is we get swelling. We have increased fluid on board. So there's a group of drugs called diuretics that are generally prescribed that help pull the fluid off. And in order to pull it off, we urinate. That's what makes that's how the medication works. There are medications that help the pump, to help the pump work stronger, to help the efficiency of the pump. There are medications that are used to decrease the workload of the heart, to slow the heart rate down. That's your beta blockers, which is a category typically prescribed. If it is a disease of the electrical circuit, meaning the electrical circuit of the heart has misfired, like atrial fibrillation, for example, is very common. And in atrial fibrillation, basically the top two chambers of the heart fibrillate or shake versus that can cause a lot of different things, including stroke, because you increase your risk of clots with atrial fibrillation. So the treatment for that would be either to get you out of it, and we can get you out of that by an invasive procedure called an ablation, for example. And an ablation is basically, we map out the electrical circuitry of the heart and find out which circuit is misfiring, and we zap it. Basically, we zap what part is misfiring in the hopes that the heart will restore normal function. Blood thinners are also given in that case. So there are a lot of different modalities that we use to treat. But exercise and good nutrition and stress relief and self-care are probably some of the most important things that we educate patients on as well, in addition to medicinal and invasive procedures.
Okay, great. Thank you. Yeah.
Good information. Let's talk about the nutrition piece for a little bit. Are there foods we should incorporate in our diets to make heart disease less likely?
Absolutely. And Kim and I talk about this all the time because, with our journey with heart failure, I think this was probably the hardest thing or the hardest change that we had to incorporate in our lifestyle. It was probably one of the hardest. I told I was the queen of the Slim Jim. during my whole nursing career, because it was a quick food, but it is loaded with salt, so we had to make some changes to a healthier lifestyle. So, some of the better things to incorporate in your diet, of course, is your whole grain foods, your higher fiber foods are one thing. Your fatty fish, the ones that are higher in your omega-3s are better. Your salmon, for instance, are better to incorporate. Your foods that are lower in your sugar, those refined sugars, you need to try to cut out. If you're a soda drinker, you need to let them go. Anything, the sodas and those real sugary drinks, because anything that's going to increase your risk for hypertension, for diabetes, those are the things that are going to increase your risk also for cardiac disease. So those are the things that you need to let go and switch over. So your high fiber foods, your low fat foods, your foods that are higher in and lower the salt out of your diet. We only need 1,500 milligrams of salt per day. And that's not a lot of salt.
It's not
a lot of salt. And I always sort of use this example of, and it's so bad, those kind of oodle or noodle things. And a lot of people don't realize how much salt is in these things. So I sort of use that as my example. And they don't realize that that's like 2 servings, that you're supposed to split that, don't eat half of it. But we don't read our nutrition label. So we really go in with that.
Yeah. Okay.
But those are just
so if you were that, if someone eats oodles and noodles, right? You said that it's 2 servings. I had no idea, because it's just a small little packet of noodles, right? So if you eat that, how much salt are you taking in?
I'm glad you asked.
Are you taking in your whole week? Yeah.
So it varies just a little bit depending on the brand, but if you look on the back of the packet, it says, when you look at the nutrition label, it says serving size 2. So you're supposed to split that little brick and split that little seasoning pack and only eat half in a serving. So in half of the serving, it's about 950 milligrams of salt in half of it.
Oh my!
So if you eat the whole thing,
you've
consumed more than your daily intake of sodium in a pack of noodles and noodles. And then we feed it to our kids, and they're adding cheese and hot sauce. And I'm going to add more salt to this thing. So we're eating thousands of milligrams of salt. And then we wonder why we can't get our rings off. We can't get our cute shoes on. And all of this because we're overloaded with salt.
Yeah.
So, but we don't realize it's not what we're putting in the food; it's what's already there.
Do you know? And I'm sure you do, that college students live off those.
Exactly.
They do.
Exactly. And we've done a lot of talks on college campuses about the oodles and noodles, and their eyes get big as saucers because they have no idea.
Right.
And we actually did a talk at one of the local colleges here. And because the talk we did, because they were actually buying them and purchasing them in bulk because they were cheaper to get to the students. And they actually pulled them after our talk to get something else for the students because we don't realize what we're doing.
Yeah.
We just don't realize it.
Right. Wow. So,
and your leafy vegetables and things are also things that you need to add to your diet.
Well, this has been such great information. We want to end by asking both of you, what advice can you offer women to encourage them to take better steps to keep their heart healthy? What can we do to do a better job?
Just a quick couple bullet points. Know your bodies. Pay attention. Don't take no for an answer if you know something is wrong. Rest. Self-care is not a bad word.
That's right.
We like to be servants and we like to take care, but learn to say probably the hardest word for me to ever say in the language is no. We don't say no enough because we feel guilty. We're supposed to be taking care of the world.
Especially as Black women. Yeah.
It's like in our DNA. We got to get past that. So those are my bullet points. We got to take better care. Our village is counting on us to be okay. And in order for the village to survive and thrive, the women of the village must survive and thrive. And we've got to take better care and turn the mirror on self.
Yeah,
And
great.
just to sort of piggyback off of what she said, usually at the end of my classes, I always sort of give them this little bit of homework to do. Every day, take 15 minutes to do something that you enjoy. And it has to be something completely separate from your job, away from your children, away from your significant other. You have to step away for 15 minutes. And I tell them, even if it's going to go to the bathroom and close the door, even if you're not doing anything in there, because nobody's going to bother you in the bathroom, just
Mhm.
go in there and shut the door. Time yourself for 15 minutes and just bring it down for 15 minutes. In 24 hours, you are worth 15 minutes. And make that a habit. You're worth 15 minutes, and do that. You have to do it.
Well, thank you
That's
both.
one of those. I was just going to say that's one of those drop the mic comments. I love it.
Yeah. Yeah.
Absolutely.
Well, Shaun and Kim, thank you so much for joining us. Excellent information. Again, we applaud you on caring enough to share your story, to turn what could have been a negative into such a positive, to care for others, to improve lives. We don't take it lightly what you're doing. And we pray that you will continue to be blessed, because we certainly are so thankful for your care and your efforts. So that's all we have here today at Earrings Off. Both of you, please take good care.
Thank you so much for having us. We appreciate it.
Thank you for having us, and you all take good care as well.
Take care.
All right,
Thank
take
you.
care. All right, bye-bye. Thanks for joining us, and have a wonderful day.